So what is your reaction if the patient comes back and says, "Sir, you have prescribed this particular medicine and it contains a Vatsanaba, or it contains a marking net or Ballataka or certain basmas." How do you console? Or I mean, this is for in educating a young Ayurveda practitioner, how we should tackle that question.
See, very simple. If a person comes to us thinking that Vatsanaba, Nakshomika, Kupilu, all these things, they are the Vishadravyas, and these things, of course, they are Vishadravyas. We never said it is not Vishadravya. It is Vishadravya. But how can you prescribe it? Then my question comes, then how can they made it in the medicine? If it is a poison, then why they have put it in the medicine? There are drugs, if you just go through Western medicine, most of the drugs beyond the therapeutic dosage, they are poison. But still people are using it. So everything has its own limitation, and within that purview of the limitation, we should use it. Similarly, for Vatsanaba or Ballataka or even Kupilu or whatever it is, all these are being subjected to Ayurveda medication as a medicine. Before that, they will be subjected for Shodhana. They will be subjected for purification process. Once there is a purification, their toxic effects are nullified. Their therapeutic effects are enhanced. Then only we are using such type of dravyas. And moreover, these dravyas, if you are feeling is a poison, then why they have introduced it to the medicine? If it is a poison, how can a doctor prescribe a medicine? I mean, a poison. It cannot be. So, it is a poisonous drug or a sharp drug or upavisha or visha, but it is being subjected for shodhana and purification, and that means toxic effects have been nullified or reduced to a great extent. Then only it is modified in the form of a medicine and it is prescribed in the medicinal dosage or therapeutic dosage. Then there is no question of any toxicity or toxic levels of problems. Of course, provided these, when the nanoparticles or the herbo-mineral drugs are there, if they are not properly prepared, genuinely prepared according to the textual references and the methods adopted, if you are bypassing it and causing it, something like in order to curtail and cut down on the production cost, if you are doing nonsense, then there is a chance of causing damage in the form of a toxicity. So we should be very careful in these type of things. So try to select the brands and the companies, they stick on to the very classical methods or the scientific methods of producing a medicine in a systematic manner and in a prescribed format and in a dosage. That will be very right way of selecting the one and using it.
And I remember one senior professor, Dr. Krishnamurthy sir, in his practice, he will openly say that, yes, this contains heavy metal ingredients, they have been purified and processed. Yes, I'm intentionally giving it to you to a certain period of time because they have their own therapeutic effects. And he's kind of open and, like free in his approach. So no hold back and, back the science and back yourself.
That's the reason. See, we need to be very clearly in our thoughts. Why you are prescribing a heavy metal? See, it is not a heavy metal. It was a heavy metal. When I am prescribing, it has become a light metal. Once it becomes a varitara, floats on the water, it is not a heavy metal. It is a light metal. So don't be in a dilemma that something heavy metal has been given. No, it is not heavy metal. Basically, previously it was a heavy metal, not now. Now it is in the form of a bhasma, and thus bhasma floats on the water, varitara. It has attained such a level, and now it is in a nano size, and that nano size particle never gets sedimented anywhere in the body. It will be just thrown out of the body. It does all the therapeutic action and goes out of the body. Nowhere it is found. So that is the reason, that is the beauty of Rashastra, drugs. We need to understand that. Of course, when a particular dravya, medicine, containing metals or minerals that is being given like arsenic, mercury, lead, something like that. Of course, they are in original, they are formatted, they are toxic, highly toxic, heavy metals. But once they have been subjected for shodhana and all these things made it to a form of bhasma, and it has attained all the classical features of standard drug of what you call Rekha Purnata, Varitara, Apunarbhava, Nischandrika, and all these things. If it is very clear, then definitely we can use them in a right sense and right manner. Once it is used in a particular pattern, it won't give you any side effects. It won't, and of course, during the process of medication, if you check the serum mercury level or serum lead level or serum arsenic level, definitely it will be high. Definitely it will be high because we are giving them. But once the therapy has been stopped and the medicine has been withdrawn, after 15 days or 20 days or 1 month, then you check it up. Still, if it is high, then we need to go for some chelating agent to remove those toxic material present in the body. If it is not there, then automatically system will only flush them out of the system. So usually it won't be a big issue or it won't be a problem, provided if you select a right company, a right brand and a right medication in a right dosage.
Yeah, more open we are, more good to the science as a whole, and more good for ourselves, that patient will start trusting and referring more and more patients.